to be broadcasted live on YouTube streaming and as well as during this WebEx session. For the session tonight, which is titled Diabetes Complications, we have two speakers and myself. So we will start by introducing Professor Mirella Diplovic. Sorry if I butchered your name, I'm sorry. But Dr. Mirella will be talking to us about the acute and chronic complications in diabetes or associated with diabetes. Professor Mirella is currently at Aberdeen University. She holds the Dean for Industrial Engagement in Research and Knowledge Transfer. She's also the director of Aberdeen Cardiovascular and Diabetes Research Center at the School of Medicine, Medical Sciences, and Research Nutrition. She obtained her bachelor in pharmacy and her PhD from Edinburgh University and her PhD in biochemistry from Dundee, University of Dundee. She did her postdoctoral training or fellowship at Harvard Medical School, and today she will tell us about the diabetes complication. Part of it is in her research, actually. Her research is focused on tyrosine phosphatases and their role in modulating signaling pathways in obesity, insulin resistance, etc. So thank you for joining us, Professor Mirella. We appreciate you being here with us. You will be talking to us for about 45 minutes with question and answers and discussions. We also have with us Ms. Dina Abu Shanab, who is our own student, and we are proud of her. Ms. Dina graduated from Qatar University College of Pharmacy, Bachelor of Pharmacy, and also she obtained her master's in pharmacoeconomics. She works at Hamad General Hospital right now, and she's heavily involved in developing guidelines, and also she serves as the president of Pharmacy for Postgraduate Society, among many other things. She also had published research and peer-reviewed journals. Myself, I am Susu Zugayer. I'm Associate Professor of Microbiology and Immunology at Qatar University College of Medicine. I have a clinical microbiology training by my background, and my master's and PhD is in medical microbiology and immunology from Cardiff University. My postdoc from Harvard Medical School about vaccine immunology. And then I went to Emory University as a faculty before I joined Qatar University. I will be talking to you about diabetic foot infections. And following me, Ms. Dina will tell us about the economic burden of diabetes complications. We are going to, before we go ahead and start, I just would like to inform you about this diabetes unit that we've been running through the CPD program at Qatar University in collaboration with the Ministry of Public Health here in Qatar. This is the 6th session and the last of a series. So we started, the first one was about diabetes as a disease, the diagnosis, classification, and management. The second session was diabetes review and optimization. The third was managing type 1 diabetes. The fourth was about nutrition and lifestyle management in type 2 diabetes. The fifth was patient-central care approach in diabetes management. And this is the last session of the series, and you will learn hopefully interesting stuff about diabetes complications. One more thing that I'd like to bring your attention to earn the credits or the certificates for you attending this CPD posted to you here, and it will be open at the end of the session. Please fill the evaluation to earn your CPD credits and to get the certificates or participation or whatever you like to have by joining us. All right. I think I introduced my guests and I welcome all the attendees here tonight with us. I want to ask you to be as engaging and participating as possible, meaning please type your questions, your comments, your queries, anything you would like to ask about or participate. You have the chat button, so just please type in there or raise your hand and let's have an interactive session tonight. We prefer for you to be engaged with us all the time, and we're here to have an open discussion in addition to fun learning. I hope so. So without further talking, I am going to give the floor to Professor Marella to share with us her talk today. Professor, if you could please share your slides with us.
Okay, thank you so much for that kind introduction, Dr. Susu. By the way, at the moment, I don't see the share button next to me. So
yeah, just you may need to make it to Dr. Marella, Dr. Susu, please.
Yeah.
It's not Dr. Dina.
Okay, that's fantastic. Thank you. So while I'm just looking for my screen here, I would really like to thank you so much for inviting me here to join you for this. Oh, sorry, I'm just going to come out. Here we go. Yes, I would like to thank you for inviting me today. I think this is a fantastic series of events you've organized, obviously, and I wish I'd been through all the other ones. I wanted to ask the audience at any point that they have a question, please just post a question. I should say to those who have joined hoping for a research talk that this is not a research talk. This is kind of an overview talk and discussion about kind of the complications that come with diabetes, the burden on the society, on people's health, as well as the healthcare systems. But I have actually included towards the end of the presentation some of the unpublished data from my own laboratory as well, just to kind of make it as interactive as possible. So please, if you have a question, do post it. And I think Dr. Susu will pick up questions and just stop me in the middle. I don't want this to be a lecture. It's meant to be interactive. So it'll be wonderful to have a nice interaction with everybody. So yes, my talk is about acute and chronic complications associated with diabetes as a disease in general. So I just thought I would start off with kind of normal physiology and how our bodies work in general. And I think our bodies are absolutely amazing at maintaining kind of this normal glycemic levels. So we know that when we eat, when we consume carbohydrates, our bodies are fantastic at kind of detecting this rise of blood glucose levels due to consumption of carbohydrates, and stimulate the pancreas to kind of stimulate the beta cells to start producing insulin. So what I've presented here is kind of the insulin secretion pathway and positive and negative things that insulin stimulates versus things that insulin shuts off in order to maintain normal glycemia. And if we are thinking about millimolars in glucose, we know that normal glucose levels are